YouTube, welcome back to the channel. I'm Kathy and this is my little greenhouse. In my last video, I talked about how my husband has hairy cell leukemia and we've been doing the treatment process for that. In today's video, I'm going to be talking about what we keep in our emergency hospital bags. So with cancer treatment, my husband's immune system is pretty low, which means anytime he runs a fever, we have to go to the hospital to get him the help he needs because basically his body can't fight off infections on its own right now. So we keep an emergency hospital bag ready. I've got everything written down, so if you see me look down, I'm probably looking at my list. Some of these are going to be really obvious, and some of these are going to be things that's like, make sure we have that for the next time. So with that process, normally first place we go is the ER, and then he can get admitted to where he needs to go from there. Sometimes the ER process, if you've ever been in an emergency room, you know the waiting game can be pretty long. Usually, because he has leukemia, he goes into an exam room pretty quickly, but then we have to wait on a hospital bed to clear. So sometimes we're there for several hours, and we know anytime that we go on these trips, that he's probably going to be in the hospital for a few days. So we have a few days worth of things with us. Number one thing to always remember, toothbrush and toothpaste, because it'll just make your life better. We usually take these little bags. I got them at the Dollar Tree last year, I think. I had made goodie bags for my students and had some left over, but they've actually worked really well for this because the little bag has the toothbrush, the toothpaste, and the toothbrush cover all in there. And it's just easy for us to throw in our bag and go. And then at the end of the hospital stay, you really don't want a toothbrush brought home with you that's been at the hospital because you're going to feel gross using it. So we just trash it at the end. And it's made life easy. It's also good because then you can put it back in the bag so you know your toothbrush is not getting covered in anything. Having these last time we went to the ER came in such handy because I was actually able to put them in my purse, and we spent the night in the ER before we were moved into an actual hospital room. So that next morning, having these where we could brush our teeth and feel human again after staying in the emergency room for like 10 hours, that was just the greatest. So make sure you have that. Of course, your normal toiletries, you should have shampoo, conditioner, soap or body wash. We normally have the little bottles that we just refill between trips. Of course, another thing is some form of lip balm and lotion. You will get pretty dried out because they try to keep the humidity low in the hospital, so your skin's going to get dried, your lips will get chapped. You're using all the sanitizer to keep infection risk low, so you need lotion. Those are all pretty standard. I usually bring out some of our own hand sanitizer too, and I just get whatever bottles they have. This came from Walmart. It's unscented because you don't want to be taking scented things into the emergency room. They can make people cough and sneeze and different things depending on what they're sensitive to. So we go with unscented, but I just like having our own because then if we need to wash hands real quick or something, we've got it just with us. We're not having to find one on the wall. I've also found that this doesn't dry out my hands quite as bad as the ones just in the pumps at the ER, and just having it with us, that way it's there when we need it, has been a blessing. So that's that. We usually also pack, because we know we're going to be there a minimum of a few days. At first we used to just pack a pair of pajamas and an outfit for the next day, but since we know standard procedure for him right now is at least 72 hours of monitoring and all of that, we just usually pack 3 outfits and a hoodie so that we're good, and then we pack pajamas. The number one thing I would say, don't forget, in the haste of packing, don't forget undergarments, because you will want fresh undies. And 2, pack way more socks than you think you need, because if you're staying in the hospital for a few days and you're in the hospital room, normally they'll give him some of the little hospital socks with the grippies on them, but you're just going to want to change your socks frequently in case you have your shoes off at all. You don't want to be reusing socks that have been on a hospital floor. So we just bring a lot of extra socks because we know we'll be there for a few days. And they might be socks that we sleep in, or socks that we change into to put our shoes back on, because you don't want hospital floor going into your shoes when you put your shoes back on. So we just pack a ton of socks. Of course, remember your hairbrush, your comb, whatever hair ties you need, that kind of thing. It doesn't need to be fancy. You're at a hospital. Another thing that I normally bring is extra masks, because they have masks at the hospital, and that's great, but they tend to do worse with my acne. So I normally bring a lot of cloth masks too, just so I can be a little bit more comfortable wearing them, sometimes multiple hours at a time, until we find a room. And every time we have to go out the room, I need a mask. So I just bring a lot of masks. Another thing that we normally bring, technically we could wait till later to bring this, but I normally go ahead and put them in the car anyway, is our personal pillows, because those hospital pillows do not do anything for you really. And it's just so much more comfortable to have your own pillow. I will do another video later for what to bring if you're going to have an extended hospital stay. But to me, night one, the pillows matter. Of course, we don't bring those in when we first check in at the ER. We wait until we're assigned a hospital room. But having them for when it's time to bring them in is just wonderful. Other things, I think I already said a hoodie. Just for comfort. Of course, bring your earbuds, your phone charger, something to read, those kinds of things, just to keep you entertained. Another couple of good things that you need to bring, I'm just going to say it, some type of flushable wipe. It doesn't have to be this brand. Whatever brand you use is fine, but I'm just going to say it. The hospital toilet paper is not going to do you any favors, and if you're going to be there a while, you need to be able to at least go to the restroom in peace, knowing that you'll be clean afterwards, okay? And in less pain, because the hospital toilet paper hurts. So we bring those. A couple other random odds and ends. These might not necessarily be in your hospital bag, but you should have them with you. Have a notepad and a pen. I know you can take notes on your phone, but it's different having the little notepad and pen if you want to jot something down. I sometimes will even be taking notes on the things that the doctors say, just so I make sure everything's lining up from moment to moment, and so that we don't forget things that they tell us either. Always have some cash, just because you know you can buy stuff if you need something. Having cash money is good. And having little money too for the vending machines is good in case you need a snack or something, because you don't know when you first get to that ER when you're going to actually get assigned a room, when you're going to be able to leave again and get food. So just having some money for the cafe, the cafeteria, the vending machine, whatever it is, the gift shop, have some money with you. It's also a good thing to have any of the current medicines that he's taking. We always bring his current medicines with us so that we can answer any of the questions that the doctors have. Last time we went, I even brought his most recent printout from his oncologist office, just so that they knew what our upcoming schedule was, where we were in the treatment plan, all of those kinds of things. I bring those type of documents, medicine he's taking, and this one, of course, whatever insurance that you would need at that initial check-in process, as well as ID, that kind of stuff. So I think that's everything that you need for that immediate, all right, we have to go to the emergency room, we have to go to the hospital, these are the things that we need to have with us. That's pretty much everything you need for that initial, get you through the ER part, get you into a room. And my next video, I'll also do a what you need for an extended stay. And I'll talk about how that works in the next video. If you have any questions or comments, or if there's anything you think I left out or has worked better for you, drop a comment below so that to help us so that if there's something we're not thinking of, please let us know, but to help someone else out who needs to know too. And I will see you in the next video. Thank you so much for watching my video. Let me know what you want to see next, and remember to like, comment, share, subscribe, ring the bell, do all the things, and so long from the little greenhouse.